transfer. Absolutely. So in our practice, there are times that we always inform you about the progress. So the important days is number one, on the day of the retrieval, we tell you how many eggs were retrieved before you leave the office. The next day, we see how many of the eggs successfully fertilized. So you get that first very important update. On day 3, if we're looking at the embryos at that stage, we'll tell you how many have made it to day 3 and how they're looking then. And then the most important then are the final updates, days 5, day 6, telling you how many embryos reached the blastocyst stage and could be frozen, biopsied and frozen, or just frozen. There are a number of points that we can transfer the embryo. The main timeline is to count from the retrieval. We can do a transfer in 3 days or 5 days. These days, I pretty much transfer 99.9% of the time only on day 5. Why is that? Well, there are a number of reasons. The main reason is that it helps us select the embryos that have the best chances of success. If the embryo makes it to day 5, it has proven that it is stronger and therefore more likely to be normal and more likely to be successful. Also, on day 5, we are able to select better, so that the whole grading scheme that we talked about at the outset is best done on day 5, whereas grading on day 3 is not nearly as predictive. So we're much better at finding an embryo that has the best chance of success if we do transfer on day 5. The argument for day 3 would be that what if the environment in the woman's uterus is more favorable for the embryo to develop and succeed than the environment in the laboratory? So this is particularly for patients who've gone through an IVF cycle or 2 and waited to do a day 5 transfer, but none of their embryos ever made it to day 5. They arrested in the development on day 3 or 4, right? So they're saying, well, I would just like a chance to have a transfer because maybe my uterus is going to be a place where these embryos have a better chance of survival than in the laboratory. And so that's a theory, but I'm not one that favors that theory, because my belief is that at this point, we have gotten really good at growing embryos to blastocysts in the laboratory. Initially, we were not very good, and our culture media were not very good, and so we had poor progression of embryos to blastocysts in the laboratory. But now, we know pretty much exactly what the embryo needs. What is the temperature that they best grow in? What is the oxygen concentration, the CO2 concentration, the acidity, the culture media, what nutrients need to be present? So these things have been largely answered, and we know the ideal environment for the embryo to grow, and we accomplish that environment best in the laboratory. And I would argue that the environment in the laboratory is a better environment than in the uterus. So if the embryo does not survive in the laboratory to make it to the blastocyst, I find it highly unlikely that it would have survived in the uterus. And therefore, for most people, there's no reason to do a day 3 transfer, but best to wait to day 5 and select the embryo that will give them the best chances of success. It is true that some clinics do not go beyond day 6 after retrieval for freezing embryos and discard any embryos beyond day 6 that didn't make it. The reasoning for that is that overall, day 7 blastocysts have lower chances of success, lower pregnancy rates, and therefore many clinics feel it's not worth growing the embryos to day 7 because if you do a transfer with day 7, you've gone through the effort, the time, the cost, but a lower chance of success. However, especially with PGTA, we still see pretty good results if a euploid embryo, a normal embryo, is found, even if that was a day 7 embryo. And just to make sure we're speaking about the same things, when I say day 5, day 6, day 7 embryo, all we're talking about is how long it took that embryo to develop to a stage that it could be biopsied and frozen. So embryos that make it to that stage on day 5 have been growing faster, and therefore we presume are stronger and therefore more likely to be normal. Whereas embryos that took 2 extra days, on day 7 only, then did they reach the stage that we could work with them, developed slower, and that is an indication that maybe something is abnormal about those embryos, and so therefore that predicts a lower chance of success. However, once again, with day 7 embryos, we still see a pretty good chance of success if they're found to be chromosomally normal, and therefore in our clinic, we will continue to grow embryos to day 7 if they have potential. If it looks like they're still developing on day 6, then we'll continue to watch them. And therefore, we can still use day 7 embryos if they look to have any potential at all.